Welcome, everybody. This is Kelly Hendershot, the program director at Gilda's Club Quad City. We are here with Erin Sullivan-Wagner with After Cancer for a presentation on cancer and intimacy, which is a very important conversation for anybody who is in a relationship or looking to be in a relationship after cancer diagnosis, thinking about the realities of intimacy and what that looks like after a diagnosis. So before I turn things over to Erin, for our Facebook Live audience, I will be monitoring our chat queue. So if you have any questions, feel free to go ahead and ask them. For those of you who joined us via Zoom, you are welcome to unmute yourself with any questions, or you can also use the chat tool and I will be sure to get those asked during the presentation as well. So I'm going to go ahead and turn things over to Erin.
Hello, everybody. As she said, I'm Erin Sullivan-Wagner, and I am a former patient. I've been an advocate for patients since my experience. I had anal cancer in 2008, and I'm going to go into a little more detail about the cancer and my experience regarding sexual health. But after that, I became an advocate and also started providing educational materials for providers on how to address sexual health with their cancer patients. So I'm going to go into that project just a little bit so you can also know what we're teaching providers and people that should be addressing this with you all. And then we'll go to some question and answers. So first of all, I think we're going to see a video. There's a website that I'll probably refer to throughout the presentation. It's allofmeiowa.org, and that's a website that I led the charge putting it together. And it is a resource for patients and providers regarding sexual health and cancer care. And this video is a patient that was highlighted just to speak about her experience, and that's how we're going to kick it off.
Sorry, 1 second here. I just want to make sure that the audio is going to be playing through Zoom. We've had issues with this in the past. Let's try this again.
Can you hear that, Kelly?
Yeah, 1 second.
Okay.
We'll try this again. I just apologize.
And it won't be a big deal if we can't play it either, Kelly.
We'll just try this one more time.
Okay.
There is one extra button that I always forget. Yep, share computer sound. Sorry, everybody.
My boyfriend said, well, what's going on? What'd they say? And I said, well, they don't tell you you have cancer over the phone. So I knew. It's hard to recall exactly what was said after you hear that you have cancer. It's kind of just a whirlwind. I was 27 when I found all of this, so very young as far as breast cancer diagnosis goes.
Almost 40% of people will be diagnosed with cancer sometime during their lifetime. As a side effect of their cancer or its treatment, more than 60% will suffer from severe, long-lasting sexual health problems. Of those who are sexually active, 20 to 30% will stop having sex entirely. Cancer does not discriminate, regardless of age, race, ethnicity, gender identity, or sexual orientation. Intimate relationships are impacted by cancer. Without help, those relationships often end. This loss affects all areas of a patient's life. If the patient has children, the end of a relationship can have far-reaching implications.
When therapy's over and they say, okay, congrats, you're cured, and now we don't have to see you for 3 or 6 months or something to that effect, you're kind of left to your own devices and are able to finally reflect and think about things. And you kind of feel like you're left in the rubble, and now it's up to you to put it back together. And that's probably the time where I felt like I needed the most help, because I felt very alone for a long time.
The quality of life of individuals as they go through a cancer journey is of utmost importance. It's not about treating tumors. It's about taking care of patients and their families. It's about not just focusing on the cancer, but focusing on the entire patient, the physical, the psychological, the emotional, the philosophical, the spiritual, the sexual health of individuals.
Like so many other patients, Stephanie experienced sexual health issues after her cancer treatments. These physical side effects impacted her life.
I really lost a sense of that femininity, and certainly didn't feel like anybody could have found me attractive at that point in time. And then with the therapies, the chemotherapy and specifically the hormone therapy does cause some side effects that are very much like postmenopausal type symptoms, again with fatigue, decreased libido, and like vaginal dryness. So my interest was gone. And when we did have intercourse, it was uncomfortable. So when we weren't talking and then we weren't having that intimate relationship, it really had a pretty significant toll on our relationship.
One of the dimensions of one's whole life from a mind, body, spirit perspective is sexual health. And that's really something that we as physicians have not had a lot of training in talking to patients about. But it's a very important part of overall quality of life.
I wanted to move on with my life and be given the tools to do that. I think that it would be great for healthcare providers at each visit. It doesn't have to be a huge discussion, but at least to bring up the topics and say, you know, we talked a little bit about the side effects as far as the medications go, decreasing your libido and decreasing your desire. Is that something that you're struggling with right now? And maybe if the providers can't talk about it during that visit, they could direct you to somebody who can talk to you.
Stephanie is one of those people. Now, as a survivorship nurse practitioner, Stephanie believes healthcare providers simply do not offer comprehensive sexual health care to all cancer patients. Today, she addresses quality of life issues with all of her patients, including their sexual health concerns. But Stephanie is unique. Many healthcare providers don't know how to start the conversation, set expectations, or when needed, refer patients to other specialists who can address their needs.
And if you've never been taught, what are the questions you ask? What are the follow-up questions? What are the issues that help you ascertain whether this is a physical issue, an emotional issue, a psychological issue? Is it related to the cancer? Is it related to the cancer treatment? If you don't know those questions, you're going to feel not competent to carry on the conversation.
The All of Me Project wants to change that for both oncology care providers and their patients. We recognize the urgent need to improve sexual health care through enhanced communication, training, education, and provider and patient resources. We want to eliminate the time and financial barriers to care. Our mission is to provide the healthcare provider community with the tools to comfortably, confidently, and consistently address sexual health with their patients.
I think that my relationship would have been very different from the way that it turned out if somebody would have asked me those kinds of questions. You know, how's your self-image? How's your relationship with your significant other?
So I think it's really incumbent upon us as healthcare providers, especially in the realm of cancer care, to address those issues.
For more information, please visit allofmeiowa.org. You can make an immediate impact for your patients by hosting a half-day conference in your area or inviting our advocates for on-site training. Together, we can provide comprehensive care to those impacted by cancer. Together, we can improve their quality of life.
And just a quick reminder to those of us who have joined us via Facebook Live, we are starting to grow in numbers there. You can feel free to use the comment box to enter any questions that you have, and we'll make sure that Erin gets those answered. But Erin, I'll turn it back over to you.
Okay, thanks. All right, well, that was a video that we put together for the project, and the project is All of Me. The name of the project is All of Me, and so the website again is allofmeiowa.org, and it is a resource for both patients and providers on addressing sexual health. So there will be patient resources out there. It has kind of moved to be more of a provider resource space, so that we are constantly updating for providers to be able to go out and look at how do they address this, how do they start this. We are, I'll go into just a little bit more detail about the project so you're aware of what's going on, and hopefully that your providers too will be addressing this in their clinics. So I had cancer in 2008. And after that experience, which, you know, the sexual health, the challenges I faced with sexual health were really long lasting, forever, really permanent side effects. But after I was done with my treatment, you know, recovering as you do for so long, even if you are rid of cancer, of tumor, the recovery process is just so intense and so long. And during that time, I thought I would give back and started to coach patients through that time. So just really more of an emotional support. And when I was doing that, that was really all emotional. It had nothing to do with sexual health. I started to ask the question because it was so evident to me that the sexual health issues were there, and my provider wasn't aware of why that happened and just seemed kind of dumb about it, that I started to ask the folks I was coaching if they had any sexual health issues from their treatment. Just a kind of informal poll, really. Almost unanimously, people said that they did. And when asked, are any of those issues being addressed? Almost unanimously, I was told they are not. So I decided I would do what I could to become a voice for those patients. So I speak to survivor groups often, but I also work with the provider community, not only on that educational information, but also in conferences. We do workshops accredited through the College of Nursing at the University of Iowa and Des Moines University in the past. And so as part of my work, and it's far more voluntary than anything, but as part of my work at After Cancer, and that's the name of the website too, is aftercancer.co. And it's solutions for sexual health. And in the past, I have done coaching and advocacy series workshops and been part of different programs where developed material for young adult stress management programs. And then for the provider community, just that information as to how do they begin the conversation, normalize it, set expectations for their patients, and then refer patients out in a timely manner, because that's really the foundation of all of this. The grant, through this is a grant funded project through the Iowa Cancer Consortium since 2016. We started with that video, creating a website, going around the state with the menopause and sexual health medical director. She and I went around the state doing these workshops. We do quarterly Zoom calls for providers on addressing this. And now we're doing a pilot program in 3 different settings throughout Iowa. And COVID has changed a little bit of that, but we are just kicking off our urology pilot at the University of Iowa, and that we're in the process of that right now. We've done 1 conference, or actually 2, and this year was another conference that was scheduled for May and was forced to be postponed until the fall due to COVID. And that was a very rich, full day for providers on sexual health care and cancer training. The reason for all of this, as you guys all know, there is just a communication gap between providers and patients, especially as it relates to sexual health. For providers on the left here, I just am only showing you this slide just momentarily, just to show you that There are reasons for both people as to why this is difficult to speak about. For providers, there's very little time. The clinics are overburdened. And providers, if your medical provider doesn't know the answer to a question, very, very seldom will they ask the question. If they don't know where to refer you, they won't ask you if you're having a problem. If they don't know how to address it, they may avoid that, kind of turn a blind eye. If you're not bringing it up, they assume, well, there isn't an issue if you're not bringing it up. And of course, for us patients, we aren't thinking of sexual health necessarily as our first thought after a cancer diagnosis. So oftentimes during active treatment, we aren't aware that we're having sexual health issues. It's after treatment and into survivorship, and our medical providers are different, and we're forced to deal with this issue almost really on our own. For those of us that do realize it throughout it, if the provider doesn't bring it up to us, which is really where I think the responsibility is with the provider, it's difficult to bring this topic up. We get 6 or 7 minutes with our physicians, and most of this type of work will be done with nursing. But in that short period of time, it's hard to know how to focus on sexual health issues when I'm really fearful of my life. I really want them to cure cancer. They really want to cure cancer. That's what their focus is. It's hard to put sexual health ahead of anything else and not feel like we're being completely greedy and kind of misguided on what our focus really should be. So there's a stigma around having to, as a patient, bring this topic up as if it's not a quality of life issue and not important to us. So it definitely contributes to this communication gap. Because of this communication gap is where we really dug in and decided that patients need more. So this is a patient brochure that I'm hopeful that you'll be able to find in your providers' offices, but definitely it's on our website. And what this is for is it's a tool for your provider really to give you during a conversation about this or in a new patient folder. It outlines some of the most common sexual health issues after cancer treatment or during cancer treatment or as a result just of surgery or the treatment, and the common problems and some of the side effects and tips and strategies to deal with that. Some of the side effects that we're forced to deal with as part of having had cancer or treatment for cancer. On the left is just really the most common side effects that come from being treated for cancer. And this is by no means a full list. I really just list this here to suggest that this is not just it's not just about sexual function. It's about quality of life issues that are emotional, that can be hormonal, that are psychological, that are social or relational. These things all contribute to that. So someone might not think hair loss should really be an issue for sexual health, or fatigue or weight gain. But it absolutely is. It goes to how we feel about ourselves, how we feel about our sexuality, either our masculinity or our femininity. And it goes to our self-esteem and how attractive we look at ourselves as and how attractive we feel in somebody else's world. So on the right is the quality of life issues that come from that. I pretty much just kind of went through that. Relational though, communication issues do end up an issue due to not really having good guidance as to what most people go through related to sexual health during their cancer treatment and after. If you did have that expectation that this is going to be tough, that everything is going to change, that you might never quite feel the same emotionally, spiritually, physically, if you did have that, you might think, gosh, we as a couple, if you're coupled, your partner and you might think we might need some help with this. And this expectation would be set that we might need some professional help with this. When the expectation isn't set, it really just leads to issues not only with self-esteem, but communication issues where we're just really not relating to each other. My cancer journey began in 2008 with the diagnosis of anal cancer. Actually, I had never heard of anal cancer. I went through my journey with Farrah Fawcett, for those old enough to know Farrah Fawcett. My result was much better, but when I was diagnosed, this was the look of my blended family, my husband and 4 children. And at the time of the diagnosis, I think you probably all can appreciate that it is just shock, and the pain and confusion around a cancer diagnosis, just there really is nothing like it. And it was true for me too. I was diagnosed with anal cancer, but they didn't know it was anal cancer at first. They said it was, I had a colonoscopy because though I had never had hemorrhoids, I had some bleeding with bowel movements, and that was odd to me. I was 49 years old, and I went to my doctor early. And that is also very unusual for people to go early. It just was so unusual for me. I had a colonoscopy and found that I did have anal cancer. And at the time, they didn't know if they were really classifying it as anal cancer. And so for a very short time, they did more tests, and they believed that possibly the cancer was above actually my cervix, and thought maybe that the cancer they found in the anal canal was really not the home. And so for a short time, my diagnosis was really quite grim. And, really within 48 hours, I had this blessing of, oh, you only have anal cancer. And that was, huge to me, that it was something that is 90%, the survival rate is 90%, and that I was going to be able to get through this, even though I had never heard of anal cancer. So I did go through chemotherapy and radiation for 5 weeks, a week at the beginning and a week at the end for the chemotherapy. It was 5-FU and mitomycin. And then I had radiation therapy it was 24 days. At the end of my treatment, they did say there was no residual effect there were no tumor, there was no residual effect from the cancer. They believed that we had taken care of it. At no time was sexual health talked about to be a concern, except to tell me that because I was young, healthy, and sexually active, that they didn't think that I would have sexual health issues at all from the cancer or my treatment. At the time that they said that, I really didn't even know what they were talking about. I had anal cancer. I didn't understand why I had anal cancer. I didn't even know what anal cancer was. So when they said I wouldn't have any sexual health side effects, I didn't know if they thought that maybe that was anal sex that I was concerned about. And I wasn't concerned about anal sex. So I just really didn't understand the whole part of you aren't going to have sexual health issues. So I didn't ask any more questions about it. It wasn't going to be an issue. Why am I going to invite a problem? So I never brought it up again. After treatment was over, so my treatment took place in February and March of 2008. And when the treatment was over, I was hospitalized for a short time, but when I started to gain my strength back, I had my follow-up appointment at the end of May. I was evaluated and told that I could resume sexual activity, that kind of like having a baby, 6 weeks later, you're all good. And you could go back to your regular life. We waited a couple of weeks, my husband and I, but with the night, I remember it like it was yesterday, that we were planning to have intercourse again. And I was nervous about it because I knew my body was different. I knew that I was very protective of anything getting very close to me. I didn't feel completely healed, but I didn't feel not healed either. I just felt different. And when we attempted intercourse, it was a severe pain, just so instantly severe pain that it was impossible for me not to show with the look on my face how much pain I was in. And of course, we were both so very concerned, thinking that I hadn't healed yet, that they'd made a mistake. And I went back to my physician within a couple of weeks. And at that point, I didn't understand what the problem was. So I went back to my medical oncologist, and they explained that that wasn't their problem. The chemotherapy doctor wasn't their problem. and that I would need to speak to maybe radiation. And so I spoke to them, and they had never heard of this, having sexual health issues after treatment for anal cancer. And so they referred me to my gynecologist. By the time that all happened, though I had finished treatment in March, I was at my gynecologist sometime at the end of August, and she did an exam and realized that there was scar tissue within the vaginal canal and this scar webbing from the radiation treatment, and believed that that probably was what was causing the issue. And so a minor procedure was done to remove the scar tissue, and I was told at that time to use it or lose it. And so we tried really just with everything we had, as if we were trying to have a baby. We tried to have intercourse so that this area would stay open. So at every attempt, it always ended with severe pain, often blood, tears always. It was impossible. I could tear now thinking about it. It was impossible for me not to react like somebody was stabbing me. It was that painful. I knew I wasn't okay, and they weren't able to tell me why not. So I kept going back, and we chased every treatment there was. And I went to rehabilitation therapy, and they needed the muscles of the vagina, the vaginal walls. They needed those muscles until I bled, really, just making sure that they weren't like concrete. And I tried every lotion. They did start me on dilator tools, which truthfully, I don't want to be so scolding, but they should have started me on dilator tools the minute they knew I had cancer and was going to have radiation abdominally so that I would keep that area open, but they hadn't. So they started me on dilation tools and estrogen cream. And a dilation tool is something that looks like a test tube, and they're graduated in size, but they are to mimic like what the size of a penis would be. And I was to insert that with like an estrogen cream on it so that there was some lubrication. Of course, I would need that. And it would stretch the muscles of the vagina. And I would do that after I had used lidocaine, a glass of wine, any other relaxation. They finally resorted to, 2 years after chasing treatments, they resorted to giving me Xanax. And they told me that they thought that that would help me relax. So the first time I tried that, I fell asleep. And that, so of course that didn't do the trick exactly. But when they gave me Xanax, something else happened. And my husband said to me, that's so interesting. I wonder if they think that it is in your head. And I said, that's so interesting that you say that. Do you think that this is in my head? And he said, well, I've wondered about that. And you can imagine that was just fertile ground for not such a great conversation. There was so much anger and hurt built up in me since I had for 2 years been chasing every way to fix this and couldn't. And in the background, what I could see in my husband was, for sure, at first, he was so concerned. And he really had been really the best caregiver that anybody could imagine being. But the concern he was so disappointed when we couldn't go back to our life. And he hoped with every turn that, with every new treatment that we'd be able to figure it out. And so did I. But every time that it proved to be the same thing, that intercourse didn't work, we didn't know as a couple to work on it any other way, to work on staying connected any other way. And I watched him move from, I would say hurt, disappointment, to frustration, and eventually just silence, really. He didn't ask for much. He didn't suggest. It got to the point where really I would suggest having, to attempt an intercourse with a new treatment in the hopes that maybe it would work. And he finally said to me, I can't do this with the look on your face. I can't be the source of this pain for you. And honestly, Erin, there's nothing arousing about it. I don't even want to do this. And I knew we were at a different place when he said that. And slowly I would, in the background, work on things that maybe would help me figure this out. But we as a couple, we didn't work on it. I worked on it and probably was a bit resentful about the way we were handling it, because we really weren't. And, you know, we felt like we were okay. We were raising 4 active children that were in middle school and high school. You know, we had a lot of activities. We knew each other's schedules. We showed up for dinner every night. We slept in the same bed, but we just were not in any way connected at all. And it just didn't feel like intimacy. I knew then, or actually I probably didn't. It was just such a gradual breakdown of who we were, that by the time I could see who we were, and I knew it wasn't intimacy, I didn't even really know how to fix it. Didn't even have that much drive to fix it. All that fatigue and that emotional change we all go through after cancer treatment had just taken its toll on me too. I was weak, kind of over it, unable to think of a one more way to take care of this for both of us. At that time, I knew that we probably needed help and didn't know what to do about it. It seemed easier to let it go, and I did. I let it go, and we separated in 2016, and then there is more to that story, and I will go into that, but I want you to know that everything I've just said to you is not even so unique. My story really isn't very unique. It is so common for all of us to have some of these issues, most of these issues, even different issues on top of that, that have to do with our relationships with other people. If you're partnered, it's really obvious to see what I need to work on. If you're not partnered, then you have a whole nother layer of complication to this. It's getting comfortable with understanding emotional intimacy in yourself, what you need to feel peaceful and whole, and then what you actually can give to other people and what you need from other people. If you aren't partnered at the time, I think it makes it even more complicated. What it comes down to, in my opinion, this comes down to intimacy. It's not just physical intimacy, but it's emotional intimacy too, and there is a difference. I put the definition of intimacy up here just to have it bring it to the forefront of our thoughts here. Intimacy is linked to the feelings of closeness among partners in a relationship. It's usually characterized by love and attachment. Intimacy and healthy relationships go hand in hand. The main forms of intimacy are emotional and physical. We all understand these definitions, but when it really comes down to it, this is how intimacy feels oftentimes with the sexes. It feels like it's his definition of intimacy is sex, and my definition is cuddling. And it's also there's a communication gap that can happen if there is a difference in how you feel as to what intimacy is, the definition of it and the importance of it. What happens here with intimacy from a functional part? These are some of this is to show you how complicated this can get, but these are some of the components that drive satisfying encounters or emotional and physical intimacy, positively and negatively. So if you're having communication issues, if you look under the stimulation, there's communication issues. If you're having communication issues, you can see that could easily, because of that, cause a decrease in desire. We like to be wooed maybe, or we don't want to have somebody disappointed in us when we're about to try to, have intimacy in a physical way, that decrease in desire can lead to decrease in arousal, which leads to decrease. All of it is tied. It leads to decrease in a satisfying encounter. Painful sex can do the same. So it's just to show you that there are so many things that go into each one of these things, and they're all tied to each other. It isn't a matter of, was I lubricated enough and was he erect enough? It's just so much more complicated than that. And the reason that this is good to know is you can start anywhere in this web. You can start anywhere and undo it. If you have different stimulation, if the stimulation either emotionally or physically, because skin sensitivity changes after cancer often, the sensitivity I needed from a stimulation standpoint was much less. He couldn't touch me the same way. It was almost painful. It was irritating. It drove me crazy, and he didn't know that if I didn't tell him that, but it definitely didn't lead to any kind of desire or arousal on my part, which of course decreased orgasm. And for us, there was an issue with being able to functionally have intercourse. It was our go-to when we could, and we hadn't figured out in our relationship all of the different ways that we could have provided to each other. Just very satisfying sexual encounters, but we didn't do it. We kept chasing how to fix what was our go-to and never really worked on anything else. And I'll go into that just here in a little bit. I only put this up because the web of sexual dysfunction for females tends to be quite complicated, and it's just worth saying out loud. Oftentimes we think, well, if a man can get erect, he can get aroused, because arousal comes to, from erection. It's more complicated than that in women, and it's even more important to start somewhere and change the pattern. So painful sex, when it starts there, it's difficult to get anything but an unsatisfying encounter. So emotional intimacy, this is something that I came to realize that was so missing in my relationship. I was focused on how physical intimacy wasn't there, but really what was missing was the emotional intimacy. And I believe all of us need that. We need the emotional intimacy. So in a partnered relationship, for us, physical intimacy was a component of that. But it was only a component. If you look at what was true for me under emotional intimacy, the components of that, those legs of that footstool, were really communications, physical security, and shared values. That really made up who we were as a couple. It's why we decided to get married. It's what kept us together. It kept us strong. When physical intimacy was no longer, because sex, underneath physical intimacy, you can see that it says touching, cuddling, kissing, and sex. For me, those were my words. When sex, which was intercourse for me, when that was no longer, what did change was the kissing changed. And I found that out much later, but the kissing, I guess, changed. And when you're not looking to have sex and you're not looking to kiss, you're not cuddling and touching as much either. Instead of fixing what that one leg had missed, instead of us doing that from 2008, when we realized we had a problem, until 2016, we instead let that one leg just really erode every other piece of it. And eventually we weren't communicating with each other verbally or non-verbally. I noticed that we didn't spend as much time together, that we didn't spend alone time together, that we didn't plan vacations. And trust then really was eroded. Eventually you can kind of see, even in theory, how you really are left in the rubble of it all, as Stephanie spoke of in the video. One of the exercises that you can do is do this for yourself. Under emotional intimacy, if you were to, this should have been blank, so sorry, you guys. If you were to just fill it in for yourself, what's true for you, this is individual intimacy. Okay, I'm coming to it. So excuse me, guys. So individual intimacy. So I did this for myself too. So if you're not partnered and you are not sexually active right now, you do need you do need emotional intimacy as well. There build that emotional intimacy, but there are components. So figure out what they are for you, fill that out, make sure that you pay attention to those pieces in your partnered relationship. Think of it actually as legs to the stool. Individual intimacy, the same way. This is important for you to do personally as well. And I won't spend a lot of time on this, just so you have this, because you're going to do this in the privacy of your own time anyway. And I can't say enough about this. And this is sexual scripts. I even put this in the presentation twice. It's sexual scripts. I don't know if any of you have heard of it, but this is how we express love and intimacy with your partner. This is what your script is. If it's how you launch into a sexual situation from a non-sexual situation. It's the script you've written from the time that you've known each other. It's what you know. I knew that when we kissed for too long, that it would definitely lead to intercourse. I knew that on a Saturday night, if I chose to wear that black nightgown, actually, if I chose to wear anything but my footy pajamas on a Saturday night, if we'd gone out, if we'd gone to dinner or gone dancing or done something, I knew that that was part of our script. I mean, we were going to have sex when we got home. Even more than that, though, think about those situations that you could count on. You know what was coming next. It was your script. How did cancer change that? I can't express enough how cancer interrupts sexual scripts almost always. You've got pain pills, you've got anxiety medication, you've got things that you might have to take. Spontaneity is kind of to the wind. You might not ever really feel like having physical intimacy anymore. It could be that the loss of libido has caused you to really have no interest, or that you're so fatigued that your energy level just isn't there. Those absolutely are sexual health side effects and should be addressed actually with your physician. What you can do, though, is you can think about what your scripts are and you can rewrite them. So there are ways that we express love and affection to each other that we could do differently if we can't do it based on our old scripts. There are tips, and you could go to the website to find that too, but tips for successful communication. This communication word is just bigger than life. It is the crux of all of it. So if you're able to communicate about what a problem is, you've really got so much of the problem taken care of just because you've got a place to start. And tips for successful communication, just if you could find a time that is a finite period of time, where you say, I'd like to speak with you no more than 30 minutes, or, let's have coffee. I only want to talk about this for 30 minutes, because sometimes me speaking about my feelings felt to him like lecturing. I don't know how that was, but that's the way it came across. And it felt like criticism. So me expressing what I needed felt like criticism. So he could take it in small doses, or anybody actually can take it in small doses. I want to speak to you about something that's concerning to me. So I'm specific and I'm not vague. And I am also, it's not blaming of you or anything that you've done. It's where we are as a couple. So you can be positive with this, and there are lots of tips, and you can go online and look at this kind of thing too. But when you use I statements, just expressing how it makes you feel and what you'd really like to see, that's so helpful to a partner when they understand that it really isn't something that they're doing wrong. Cancer not only changed you, it changes your caregiver if your caregiver is your partner. It's impossible not to stress that enough. It's impossible not to spend enough to spend time on how important it is to the caregiver. Their world was rocked too with this cancer, and life really isn't the same for them either. It really impacts both. So this is something you can read at another time, but it really is just a dear diary of somebody who had cancer and their spouse. And it's reading too much into assuming too much about somebody else's behavior towards you, especially after cancer. So the importance of clear communication is there really isn't anything more important. There are different communication styles, and considering those two is important. So rewriting your sexual scripts, I had just said, list 2 of them that were unique to your relationship and how cancer has interrupted that, and what needs to be written. And this script, I put in twice, so I'm going to move on from that. There's a touching exercise that I wanted to let you know about. It's called Sensate Focus. If you've ever heard of it, you can Google it. There's lots of versions of it out there. It's really a great, if you want to be taught patience too, it's great for that. Sensate Focus, it happens over 3 separate episodes, and the idea is to learn how to touch each other, with in an intimate way, to understand that bond, the emotional bond and the physical bond as well. And it's with no expectations. So the exercise is set up so that you really are forbidden to have genital touching the first time you go through it, and the second, and it's with no expectation of orgasm, and it's really just learning as to what the best pressure point, how you like to be touched, how it feels, how that's changed, and how your partner likes to receive touch. This 5th exercise is something that I really think is important for you to do, especially if you're partnered. And do know that a lot of what I've written here is about a partnered relationship, because it's how I experienced, the demise of that relationship, looking back on how it gradually had been eroded and how I was kind of dumb to it, even though I was one of the actors in it. After we split up, I wrote a letter that was written to him. I didn't really expect to give it to him, but it was a letter that was a reflection of how cancer had changed me. It's all those private thoughts. It's how you feel about yourself, about the changes you've been through, how maybe you feel changed emotionally, psychologically, spiritually, physically, all those things that are difficult to just in a day's time state, or when asked what's so different. It's hard not to say everything, because it does feel like you're a different person. If you could write a letter about what you really wish your partner knew, that isn't so easy to state. You could do it in the privacy of your own thoughts and take as much time as you want with no interruptions. Write your feelings, your fears, how cancer really changed your roles. And what you need from your partner that they don't even realize, and what your definition of support is now, because they understood possibly what your definition of support was when they were caretaking you. But knowing now is a much different thing, and it's different than what it was before cancer. So I did this. I wrote a letter, and I really didn't expect to give it to him, but I ended up giving it to him. And I did get a letter back. And the letter back that he wrote, he was so shocked that I thought intercourse was so important. And I can tell you from my viewpoint, I thought it was so important because he thought it was so important. And I know he did. But if I was to tell you how I knew that, I would do a lot of presuming and what I believe to be true. It wasn't from anything said. His letter back to me said, if you only knew that intercourse wasn't it, you stopped kissing me. You stopped caring about us. And I really hadn't, but it probably showed up that way. And I really, at the time, think, gosh, that would have been so easy to have told him that that wasn't true, but I didn't know to. When you don't know that you're in the middle of chaos, that you don't see it as chaos, you're just getting through and surviving, it's tough to know how to fix it. Some of these exercises I really encourage you to do, especially in a partnered relationship, because they can do them as well. What did cancer change in their lives as well? And really getting just to a place where foundationally you're able to speak about what is different can give you a place to start again. My husband and I didn't divorce. We separated and stayed separated for 3 years. Really planned on moving on with our lives and tried to do that. We ended up coming together again, and of course our relationship is way different. It has a lot more emotional intimacy. It doesn't have as much physical intimacy, but it does have some, and we get to that place of emotional intimacy now because we're so aware that it's the most important thing that we can do for each other. So that's just my story though, and I know that there are versions of that from everyone I coach, from actually every patient I've ever spoken to has had a piece of this. I'm open to take questions of anything that you have about my personal experience, or if you have a question about your own situation and you just like some extra help thinking through it. I'm happy to do that here, and I'm also happy to do that through email, and that's erin@aftercancer.co. Or you can also, on the contact page of allofmeiowa.org website, you can also fill out a contact sheet, and I can contact you that way. Thanks for listening to my story.
Thank you so much, Erin. I think because this is such a sensitive topic, I'm going to go ahead and end the Facebook live stream. We don't have any questions that have come in through there, and I can always get those to you if they come up later.
Absolutely.
But again, just to make everybody a little bit more comfortable, I'm going to go ahead and end the live stream. So thank you to those of you who joined us on Facebook today.